Wonderful. Well, without further ado, we are going to have our featured keynote of the evening. We are joined today by Dr. Oluponmile Olonilua, or Dr. O. She is with Texas Southern University and also on the faculty with the Bullard Center for Environmental and Climate Justice. And she'll be discussing some results of her research into local mental health and the after effects of Hurricane Beryl. So over to you, Dr. O.
Hi, everyone. Thanks for having me. I'm so excited and I'm happy to be here. Just to add more to what Ed said, I'm the interim chair for the Department of Political Science and Public Administration, and also the coordinator for the Emergency Management and Homeland Security Program. I like to sell the Emergency Management and Homeland Security Program just because that's my baby. And also, it's open to everybody because it's an online program. Right now, we only have it at the undergraduate level. We do have what do you call it? The specialization under the M.P.A program, but we don't have a Ph.D. yet. But if you're interested, or if you have kids who are interested in everything you're all talking about, you should be in this program. Anyway, so I wanted to say that. And of course, my interest is really everything you're all talking about. Like anything that involves dealing with the community, that's what I like to do. You can go to the next slide. So for about 3 years now, we've been privileged to receive funding from the Natural Hazard Center, and I'll be doing the acknowledgement at the end because they have one that I have to use at the end. So we've looked at mental health during Hurricane Beryl in 2024, but we did the study in 2025 because these funds, they're called quick response funds, so that it has to be like within 6 months of something happening, and then you get the money to conduct the study. And then this year, we're privileged again to also be looking at the health effect of extreme heat, the one that just happened. Who knows what we're going to do next? So I'm hoping we continue to work with you or with you all. Next slide. I'm not going to use the whole time because I am Jamie, Ed, you all told me it was going to be interactive. This is not like our regular conference. So I like for it to be like a panel because you all were part of it. So I'm going to be calling on you guys every from time to time, so that it's not just monologue. So we did look at the Hurricane Beryl, and I'm going to provide a background to it. I know I'm listening to everybody. Everybody is very learned here. So I don't need to go back to a lot of things. But I wanted to tell you about the Hurricane Beryl. It came from my personal experience because we all experience, I mean, most of us experience Beryl. When you will look at the survey results, only 10% said they did not experience it. I don't know, they were blessed where they were. But most of us, I know I didn't have power for 11 days and I had to travel to Illinois, to the University of Illinois for 6 weeks for research, another research from the Department of Homeland Security. And my husband was home by himself. So being home by himself, he started to worry about food, about everything that was that will mess up. And then even when they told him, when my son came to get him, to let's get out of here, go somewhere. He went, he came back the next day. So he couldn't sleep. So I was like, this is really a mental issue that a lot of people are going through. And we haven't documented those in during burial and also especially in the Houston area. So we were lucky to receive the funding. So I reached out to Jamie. I was like, Jamie, I told them I know people, and Jamie connected us with people. So I already introduced myself. My co PI, a principal investigation, is Dr. John Liu, who couldn't be here. He's at the University of Georgia. So he said he had a prior commitment. I always tell him I think he doesn't like presentations because every time I have to do presentation, he's never there. But it's good because he's doing his part in this whole thing. We can go to the next slide. My team, my awesome team, I think led by Jamie, the Houston Climate Movement, which is all of you here. Thank you all so much. And for those who are not here, I really thank you. Without you, I will not be here for the Hurricane Beryl. We'll talk about the next team when we get to the heat, the extreme heat. So we did have some research questions. Our thing really was to find out how people cope. Like I told you, my experience, that was mine. Like I knew we lost food. It was interesting. By the way, for those who don't know me, I'm originally from Nigeria, so I'm Nigerian American. So that's where my accent is from. So I make a lot of Nigerian food, and I make food in bulk because I travel a lot. I put them in the freezer. So when we had all that, everything had to, instead of throwing things away, you know what my husband did? He put out the grill and he started to turn on the gas to warm up food. I remember my second son called me and said, "Mom, I think this food is bad, and Dad does not want to throw these things away." So we wanted to look at how people cope with the stresses. We know a lot of kids, a lot of people who are in the area. Okay, so I might be in that area, but how about our students? Because I'm at TSU, right? Texas Southern University, for those who don't know. We're downtown. We have a lot of students who are also from underserved communities. And so for most of, how are they coping? We know food. We know means to get to work. We know electricity. We know money, and then people couldn't go to groceries. So we wanted to find out what are the stresses also, and then what are the primary barriers, and how are people coping with the mental health services. I remember going through the IRB process. That's the Institutional Review Board, because they have to approve our research before we could talk to people. And someone was telling me, "Do you know we do have mental health services opportunity at TSU? You should put it in there." So I was like, okay, yeah, that's a good resource, but do people even know that where they can go? So it was one of the things we wanted to find out. Next slide, please. So when we're talking about qualitative data, how we collected the data, I'm going to turn it over to Jamie. I told you it was going to be a community thing, a panel stuff. So over to you.
Hi, everyone. I'm Jamie Lawson with the Houston Climate Movement, and I'm very grateful to have had the opportunity to work with Dr. Olonilua on this. And for anybody that has difficulty saying Olonilua, it's literally just like it's spelled. So just have fun with it that way. Once I realized that, it was very helpful. So on this one, what we did is I believe that when you go into a community, you need to work with community leaders and organizations that already have a relationship there. We focused this study on two different areas, which was Third Ward and Fifth Ward. So I reached out to the Community Care Collaborative in Third Ward, and also one of our former teammates in Fifth Ward, which is New Liberty Road CDC. I hired TSU students and a community health worker with the collaborative to gather surveys. We collected 118. We did pay people for their survey, which was helpful. We paid them right there. We gave them $10. And they didn't have to finish taking the survey. That was something that was really important, is that sometimes even going over this can be a mental stressor. So for if any reason they wanted to stop taking the survey, they would still get their $10. So we did that, and then also paid the canvassers well. And that was really helpful. For me, it really helped me kind of see the best way to work with community, like some of the prices that people told me for different things to pay community members, I got from people at the collaborative. So I think that is it on that part.
Yeah, we can go to the next slide. And it was very important. That was also why we got funded for both, because our focus was to let the communities do their work, do the research for us. I was told not to come to the focus group meeting, so I just left everything to Jamie, and she did that. So I'll let you continue on the focus group meeting because I was told not to come there as well.
Okay, so on this study, I helped more on I did like sort of kind of the coordinating overall. But Daniela Flanagan with New Liberty Road, she took mostly care of Fifth Ward, and I worked with the collaborative on Third Ward. We did it a little bit different. I think for this next one you'll hear we kind of did more the same with the Third Ward approach. And that was that we paid people to participate in the focus group. We provided them with food. In Third Ward, we had 9 people, including a little girl, and paid them $50 for 2 hours, which, most of the first hour is just eating good food. And then they took it with them, those who wanted it when it was over. I personally did not go to either of the focus groups. It was important for me not to be present during that. So I would just set up supplies and then come back and get them if needed. Danielle conducted the Fifth Ward focus group. She had so many people, and she obviously couldn't pay 25 people $50. So she paid them each $10. They decided to pool their resources and have like a pizza party thing together. So it was at the Carl Walker Jr. Community Center. Oh, and with that, because and this was something Herman was asking about before the call, we wanted to have resources available for them right then, and Daniela was able to get several guidebooks. It's all the same guidebook, but it's a 2016 City of Houston resource book, and it's amazing. It has every kind of service or anything you could think of. It has all the phone numbers, the address, different kinds of things you can do, what you need, what the process is. And just to pin back onto what I was saying earlier is a large inspiration of the resource book that I was talking about earlier in the call. Um, so we did give them those, and it's a great resource.
Yeah, thank you. It's important to note that we recorded and we told people not to mention their names because we have to protect their privacy. So people will not be able to identify them. When people made mistake, I know, I think in the newer one, some people mentioned, but we will not know them anyway. But just to protect them, we will not use their names in the transcriptions. And thank you, Jamie.
Yeah,
So
who's drawing on that? Who's doing that?
I have no idea. I
All
know
right.
I edited before this, but I did not
Okay.
touch this one.
Okay. Very good. Okay, you let me know when you want me to come back in.
Okay, thank you. So if you look at it, so we have, because this study was supposed to look mostly at the underserved, the marginalized. At the time, we could use those terms. So that was what we were looking at, and we intentionally chose those two areas, the Third and Fifth Ward areas, where we knew people to help us get to this population. So we had mostly African Americans, almost 90%, and then of course followed by Hispanic population, and we have everyone represented in there. I was going to change to the next slide, but okay, thank you. And then we, in terms of gender, of course, I said of course, because I know women, we participate more in these things. Research shows that too, that we tend to be passionate about things. So we do these things. So we have almost 60% of female participated, and the male didn't do bad either. We have 37%. So that was a lot of, that was some kind of, it's not balanced, but it was good representation. And in terms of the housing status, we had 65 renters that participated, and then we have, I think, followed by about 18% that own their home. I would say that we can explain we probably can explain why this is, but I think I like in the next study where this could be, this will come into play, because now here we're talking about Hurricane Beryl, and the other one we're talking about extreme heat. So it will be very important who owns their home and then who does not. So when we asked 115 people if they were impacted by Hurricane Beryl, I alluded to this earlier, that we had 90% saying yes. And then some 10% said they were not impacted. And I said they were lucky. Next one, please. So we are not going to go over all of this, but I'm going to point out to some things. I can use my pointer. With 67% said they lost essential services. That is very important to focus for our focus tonight, to look at if you lose essential services, that can trigger a lot of things in people. So even without looking at the other ways, people 52% losing their property, 46%, and then we have 47% losing income. All of these can trigger mental health issues. Next slide, please. When we asked them how they felt after Hurricane Beryl, I think most of the 58% said they were overwhelmed. As I was overwhelmed, and 57 said they were stressed. We could see all the high numbers, with the lowest being they were numb. Even numb, that's still a lot of people. 12% saying that they were numb. And then when we told them to rate the severity of how severe it was for the experience you just had with Beryl, we had almost 90% saying from slightly severe to extremely severe. That's a lot of people. With only 9%, about 10% saying it was not severe at all. So that's a lot of people saying it was severe. Next slide, please. So next one, please.
This is the end of the third and fifth ward.
There's something on Leslie didn't show. No, I added something on Leslie was not showing. I added something.
Oh, yes. I see. You got fancy. Here we go. Okay.
I added something. So I wanted to, because it's, the whole point of us doing this is for us to be able to show the summary of what we're doing. Because part of our proposal was to say, we're going to go back to the communities. That's why I'm thanking you for the opportunity. And go back to tell them this was what we found, not just the numbers, but we have found a lot of people, because we only talked about what happened. We want to talk about the coping mechanisms that our respondents mentioned in the surveys and at the meetings. So a lot of people said they got help because they were praying, they had faith, they had emotional strength to be able to cope with it. A lot of people had family and community support. People came together to help one another. Some were ready before the time. They knew what to do before it happened. And then, of course, a lot of people, it happens. Oh, it always happens, so I'll be able to cope with it. I think this is very important for our purposes, and to be able to show how people cope with the mental stress of Hurricane Beryl. Next slide, please. So on the next one, we started to look at extreme heat, because there's a lot of study also going on in here in the Houston area that we saw. And thanks to Jamie went on there, found out the hotspots, and that guided how we did this next one. It's the same people, so we don't need to go over, because I know our time is always, but this time around, we had different people. All of you, thank you again to Houston Climate Movement, Zelma Friends, Pastor Deb, thank you. Friends of Columbia, Tab, Edge, thank you so much. Texas Houses, they're not here. Thanks, everybody. So we didn't have... Yeah, thank you. So we did have similar but different questions this time around, because we're looking at heat. We wanted to look at housing conditions, the vulnerability, not just of people, but we also want to look at physical, like the structures, how those can also help add on to mental health, and then how did people cope with it again. Same as that, as the other one. I promise you we'll be done soon. Jamie? Okay, sorry. Now over to Jamie again.
Okay, hi everyone. So for this one, I had gone to, as Dr. Olonilua was saying, I went to the Climate Vulnerability Index and I looked up mental health and I looked up extreme heat events. And these two areas were very, very high. And in fact, the mental health vulnerabilities are highest in Third Ward actually than the rest of the Houston area. So this time we did happen to work with two of our buddies on our team with their local organizations. Pastor Deb was Alma Friends Mission over in the Northline, Northside area. She's in Northline, but we also did some Northside there. And then Ed Pettit with Friends of Columbia Tap Trail in the Third Ward. We also worked with Texas Housers who helped get an additional 50 surveys for us in the combined areas and a little bit more north of that. So we did get 185. It was a lot more this time. And again, so with the surveys, it was the same thing. We paid people the same amount of money to do it, but this time we just actually gave it to the organizations right away than me kind of putting out for like different hours and stuff for different people to be able to go and canvas these. I really like the way that this one worked. I think before I managed a bit more on like ordering food. We'd have a food budget for both of the focus groups. And then this time they that money went directly to these two organizations, and so they could handle that and order that. And I thought that that was probably a lot better approach. We did like in the last study this time we did 10 participants in each, and we paid them each $50 an hour. And for Third Ward, and well, for both, we got a bunch of literature from the Office of Emergency Management from the city. We also got a bunch of resources that I pulled together, which later, if I'm able, and if I'm not, I'll put it in the notes I can include for y'all. They're really helpful. And Northline, we had Deb, do you want to talk about that one?
Yes, thank you
From the
so much.
Yes. And Ed,
We
if you also have anything.
For the Northline study, we had the 10 people, but right before the focus group, we had a team from District H come out and talk to people about federally qualified health centers, and Encino came up, and their social worker came and passed out information. And so then everybody that didn't belong in the study left. And what we did, instead of our art activity, we decided when it was over to have storytelling and processing, because it was very not stressful, but it was very it was very triggering to some people, the things they were talking about. So we had our pastry from Aranda's and coffee and water, and we broke bread and shared stories, and that was a beautiful thing. So we discussed, and also Vincino, Dr. O, very interested. You're the first study over here in this zip code, so they're going to get back with you on that, and hopefully we'll get some more studies going. You got good data.
Okay, so we are right at about time for this. So I want to go through these last few slides real quick. We do usually leave a few minutes to do announcements. Just in case, please, if you have an announcement or flyers, go ahead and put them in the chat and I will send those out. Okay, so we're going to go ahead and go through the rest of these real quick.
Okay. Because I was also going to say something, Jamie, since we're still doing analysis, since we're still doing analysis, we can end it, and then next time, no, maybe not this when we're done, done, we can now talk about this. So we don't keep people. That's a just
Yeah.
suggestion.
Okay. Well, how about I just do this real quick? Y'all can get some eye candy. Okay. Look at that. But we will send these out. And again, so this one it's all been turned in. It hasn't been published yet and analyzed and all of that. So once we have
it's
all
not,
that, we can.
sorry, Jamie, they actually came back to us and said, oh, do you all mind? We're changing templates. So now they're giving us till end of August.
Oh boy. Okay.
Sure.
Well, so I just want to say that my experience has been with these that the most important thing is community, neighbors. Especially in the first one, I did get to listen to the focus group recordings afterwards, and I fell in love with these folks because it was like, well, this happened and it was hard, but thank God for my community, or this happened, it was hard, but my neighbor brought me some food, or what have you. And so that is a big takeaway. The other one is that even if grocery stores were open, even if there was medical access, a lot of people didn't have transportation. And sadly, some of them just sat silently and suffered. In the first one, people were not aware of the FEMA assistance, so they didn't apply for it. In the second one, they knew about cooling centers, but a lot of people didn't have transportation to get to them. So that's a big issue. Transportation was big on both of those. Did you have any last thoughts, Dr. Olonilua, that you wanted to
No,
say?
no, thank you. Thanks, everybody. We're going to be sharing the results again.
Yes, thank you so much. And I just love working with you. And was so happy to have Ed and Deb on the team too, and their whole teams. That's not just them. Okay, well, I want to thank you, Dr. Olonilua, for coming and speaking with us tonight. I know you've had a busy day, so I'm glad you were able to make it.